So without further ado, I'd like to invite to the podium our moderator for this evening. He's a chief economist for Benchmark Financial. He's been very busy lately, and we're delighted he was able to make time to come out here. Will you please join me in welcoming Jerry Boyer? Jerry?
Thank you, Dr. Lessman. Thank you, Society for the Education of Physicians and Patients. Thank you, Michael Tanner and Greg Scanlon, and thank you, audience, for joining us this evening. As Hans Lessman mentioned, I've been very busy lately. I've spent most of the past 2 or 3 weeks dealing with a crisis in credit markets that is not just affecting the American economy, but has spread around the globe. It is a serious disruption in the operation of our markets. And I've spent time with journalists on air and off air, and I've been on conference calls with the White House virtually every day in the midst of this crisis. In some cases, with members of the President's Council of Economic Advisors trying to convince me of things, and more often me trying to convince them of things, and trying to enlighten one another to try to come up with solutions to the crisis that we find ourselves in. And it's a serious matter. And what shocked me in the midst of these discussions when they started about 3 weeks ago, I talked to a man named Ed Lazier, who's the chairman of the President's Council of Economic Advisors. And Dr. Lazier was talking to some of us about ways in which the government could intervene to deal with the financial crisis in which we find ourselves. Would it be an intervention in the form of buying up troubled securities? Would it be an intervention in the form of challenging the banks to have more capital? What sort of intervention would be needed? And the discussion proceeded accordingly. What sort of intervention was needed? And I tried to introduce into this conversation the notion that perhaps no intervention was needed. Perhaps intervention is what brought us here. Perhaps a perfectly sensible, compassionate desire on the part of central planners to create something like universal home ownership in the United States of America that treated home ownership as essentially a right, not a privilege. That tinkering was necessary, that banks needed to have their arms twisted a little because they weren't making the loans on their own, particularly to poor applicants, predominantly in minority neighborhoods. That some intervention was necessary. And so we went from something like a 40% home ownership rate at one point in the Great Depression to a 50, a 60% home ownership rate, and then to a 70% home ownership rate. The problem is that some of those people just weren't ready to own homes. It's an ideal that we all appreciate, but some just weren't ready. There's a time in my life when I wasn't ready. There's a time in your life when you weren't ready. But under the old set of rules of free market home provision, if the banker was in a position to ask, is this couple ready? And if they weren't, George Bailey would say, not yet, come back in a couple of years. A little more credit, maybe a slightly bigger paycheck. That system was thrown out in favor of central planning. Now, why do I mention that now in a conference about healthcare? Because it's the same pattern. The pattern is identical. It is an attempt to create a social outcome which seems desirable on the surface, which does not count the cost of intervening in the lives of people and giving them something at the expense of somebody else, creating unintended consequences and disruptions which then ripple across lives, across nations, across banks, across markets, and across globes. Last night, I watched a presidential debate, and I heard two important questions about health care. One woman asked, is health care a commodity? Is it just a commodity? And by that, I think she meant, is it just something that's bought and sold like an ounce of copper, like a ream of paper, like something you buy at Walmart in bulk, in a box? at a low price and high volume, something unimportant and trivial, or is it something essential? So essential it can't be left up to human freedom. So essential it must be provided by government. And I thought, what a tragedy. Because something in the moral, intellectual education of this woman deprived her of a third category, the largest category. Things that are important and still provided in an environment of freedom. Things that are important but not done by government. Because it's just not, healthcare is not a commodity. Commodities are interchangeable, mass-produced, low quality. Commodities are something that anybody can buy at any time, and there is no requirement that they be specific to your needs.